Today we're going to cover older adults. It's our second priority population session. And in the U.S. we have set some ambitious aging priorities. Clearly the U.S. government has a stake in how we age because of the expenditures tied to poor aging trajectories in the U.S. So the goal is to improve the overall health, function, and we want to maximize the quality of life for older adults. And so what's going on? Older adults are among the fastest growing age groups. We have our first baby boomers, and that is defined by adults born between 1946 and 1964. They're turning 5 in 2011, and then 37 million people, or 60%, are going to be managing more than one chronic condition. So not only do you have a high volume that's changing, they tend to have more disability, more disease. And so older adults are at a higher risk for developing chronic illnesses and related disabilities. Some of these conditions: diabetes, arthritis, chronic heart failure, dementia, and many experience hospitalizations. They may transition into nursing homes, and they may be receiving low quality care. The loss of independence, to be able to live independently at home, is really truly a transition in life that has a lot of significance. And we're going to talk about that in a minute. So chronic conditions are the leading cause of death among older adults. Some of the related Healthy People 2020 goals beyond just older adults, if you can believe it, this too, just like adolescent health, is the first time we had any particular special section dedicated to older adults. And so older adults face a number of health concerns and priority areas that go across other Healthy People topics, and these include access, arthritis, osteoporosis, and chronic back conditions, dementias, including Alzheimer's, diabetes, disability and health, and then more, including injury. And we're going to talk about injury prevention now. Each year, 1 out of every 3 older adults falls. And falls are often the cause of severe disability, and injuries from falls are often the trigger point for that early transition from moving from independent living to maybe skilled care or nursing homes. Injuries are associated with the fear of falling. This encourages sedentary behavior, impairments in other functions where older adults can be afraid, depressed, and then experience overall a lower quality of life. If you're afraid to walk and move, you're not going to go out, you're not going to socialize, it's going to be very lonely. So falls are the leading cause of death due to unintentional injury among older adults. Deaths and injuries can be prevented by addressing risk factors, although another area that is concerning is suicide risk. Older adults have high rates of depression. Now, we must acknowledge that caregivers play a very important role in older adult health, and especially for those who are living at home. They're typically family members who are unpaid. These caregivers are usually the children, or they have their own demands and work schedules, and so we have what's called the sandwich generation, where adults are taking care of older parents and their young families' needs as well. And what can happen is they just can't make it all happen. There might be caregiver stress and resentment. This can lead to psychological abuse, fighting, very negative social support. And so 1 to 2 million older adults in the United States are injured or mistreated by a loved one or a caregiver. So this is the area of research that I focused on. I received a National Institute of Aging R21 grant when I was in Manhattan at NYU, and we studied the prevalence and incidence of elder mistreatment and exploitation. I could go on and dedicate an entire class to the topic because it's so important and incredibly difficult to study. But it is good to see that in Healthy People 2020 there is a measure of elder abuse to say we have to start collecting data. Here is an example of where policy can become a barrier for us to understand. We see that in prescription drug in Georgia. The prescription drug monitoring program makes it very difficult to access data and really understand the scope of a problem. And the same is true for elder abuse. So hopefully we can start to change policies and improve them so that we're not needing de-identified data, we're needing to understand trends. And it is truly difficult when adult protective service data is just hands off to research in the purpose of understanding the problem. Now, hopefully you can see the importance of how many people in the US and globally we're aging, we're becoming older. The youngest countries are Brazil and Africa, whereas Canada, the US, Japan, our populations are getting older and we're having less children, and our whole entire population pyramid has shifted. So there's two main areas of importance. One is health services and the other is quality of life. So in order to maintain a multitude of chronic conditions and the burden of chronic disease when we're aging, we have changed policies. We have the Patient Protection Affordable Care Act, and it does talk about provisions within Medicare, but usually we're not utilizing the full preventive service benefits, and that's true especially of certain racial and ethnic groups. And then to ensure that the quality of care is good is a challenge. Given the shifts of our population and the aging of our population, you would think that we're having a greater number of clinicians and providers, and then what's happening is young individuals aspiring to be clinicians and nursing and psychiatry, etc., are not drawn to geriatrics. It is a time-consuming specialty, and therefore we just don't have the qualified people to understand the true comprehensive nature, the time it takes to treat a single older adult patient. So the training can be lacking, and the incentives for bringing people into geriatric medicine are truly going away or just are very severely limited. Now, to talk about quality of life, the federal government has agencies to improve the quality of life, and we know that there are health disparities just like there were for the youngest. They persist throughout life, and they continue when you are older as well. And as a person loses their ability to complete basic activities and they become more sedentary, your mental health starts to decline, and then the greater limits you have to maintain independence. You're putting yourself and others at risk. And so we need to really look at community models for how other areas are keeping older adults engaged, keeping them active, keeping them in their homes, aging in place as long as possible. We know that when you invest in services such as those, you have lower rates of long-term care expenditures. And then we cannot forget to talk about how individual determinants, social, environmental, and health service related determinants all influence older adult health. So on the individual level, we have physical activity, self-management, use of preventive healthcare services, and how these are associated with positive health outcomes. On the social level, we know that having better housing and transportation services can impact older adult access to care, and people from minority populations tend to be in poorer health and use healthcare less often. So sometimes these are where we see the greatest declines. And then health service related determinants of health, the quality of health and social services available to older adults and their caregivers affects their ability to manage chronic conditions and long-term care needs effectively. So overall, we have many opportunities, many levels of influence to improve health among older adults. I hope that you take the time to look at Healthy People and all these related objectives, the interventions, resources, and tools, as well as the data that's available. And some other areas of older adult health that are emerging and gaining attention is to look at how we can coordinate care. Right now we have such a fragmented system. If you have to go to rehab, it's completely separate than your primary care. And if you have to go to podiatry. So looking at polyclinics or coordination of care, helping older adults manage their own care so that they don't have to rely on caregivers either among their family or individuals they have to hire. Establishing quality measures so that we can ensure that skilled care facilities, etc., are truly taking care of our older adults to meet all of their needs. And then we need to advance research and analyze appropriate training so that we have providers that have the capacity to meet these needs. And then we also need to really advance the data sources for certain populations. Just like we don't know a lot about the LGBTQ populations, the same exists for older adults in these vulnerable groups. And they do have unique health needs, or they've been, the cumulative burden of their depression, their mental health needs that maybe have gone unmet for decades is only compounded with the challenges of getting older. So research for these groups has to happen, and I hope that some of you are motivated to do so. And you can always learn more by going to the Administration of Aging on health, prevention, and wellness programs, Alzheimer's disease, family caregiver support program. The CDC has a portal for falls among older adults and enhancing physical activity levels, and you can read all the references here. So please move through these module materials today. This is the last session before our midterm. It covers all of the topics through the sessions. It's open note, open book. It's timed so that you don't spend your 4th of July taking the exam. You're going to do very well, and I will talk with you soon.